Welcome to Master the Beat, from Basic EKG to Life-Saving ACLS. This course is designed to take you on a comprehensive journey from the fundamentals of EKG interpretation to the advanced life-saving interventions of the American Heart Association's ACLS guidelines. Let's embark on this journey together and master the beat. This is episode 1 of this course. Let's begin with the basics, the heart's anatomy and physiology. Although this is not an exhaustive list, it's important to highlight some of the most common misconceptions rooted in racial essentialism within cardiovascular medicine. Historically, medical literature has often incorrectly attributed differences in cardiovascular disease prevalence and outcomes to inherent racial differences. For instance, it was long assumed that African Americans were inherently more prone to hypertension and heart failure. However, recent research emphasizes that environmental, social, and economic factors, rather than race, should be the focus when analyzing these health disparities. Another significant issue is the use of race in cardiovascular disease risk prediction models. As Warwick et al. 2023 discusses, including race in these algorithms perpetuates the flawed belief that race is a biological determinant. This practice can lead to biased clinical decisions and worsen health disparities. The authors advocate for a shift towards using more precise biomarkers and social determinants of health in risk prediction models to ensure fair and equitable care. Finally, socioeconomic status is a major determinant of cardiovascular outcomes, always more significant than race itself. Research shows that differences in heart disease outcomes between Black and white patients are largely attributed to the socioeconomic status, which is the SES, rather than racial differences. For example, studies found that in low socioeconomic status areas, life expectancy differences between Black and white patients with acute myocardial infarctions were minimal, underscoring the importance of socioeconomic factors. These insights remind us that addressing health disparities requires moving beyond racial essentialism and focusing on the real problem, determinants of health, such as socioeconomic conditions and access to care. Let's get started with where the heart is located in the human body. The heart is centrally located within the thoracic cavity, nestled in between the lungs. The heart is shielded by the sternum at the front and rests directly above the diaphragm, which separates the thoracic and abdominal cavities. Understanding the anatomical landmarks of the heart is crucial, especially when assessing cardiac rhythms and performing advanced cardiovascular life support. The base of the heart, which is the topmost part, is aligned with the second intercostal space. This is a key reference point when interpreting certain EKG leads. The apex, or the bottom of the heart, is situated at the fifth intercostal space, in line with the midclavicular line on the left side. This location is essential for identifying the point of maximum impulse, which is PMI, and is a critical area of focus during cardiac assessments. It's also important to know the definitions of the surface positions. As seen in this illustration, the inferior surface is located at the bottom of the heart. The posterior surface is located at the back of the heart, and the anterior surface is located in the front of the heart. The heart wall is composed of 3 distinct layers, each playing a crucial role in the overall function. These are the myocardium, endocardium, and pericardium. Remember, the myocardium is the thick, muscular middle layer responsible for the strong contractions that pump blood throughout the body. These contractions are essential for maintaining effective circulation and ensuring that all body tissues receive the oxygen and nutrients they need. The endocardium is the thin inner layer that lines the heart's chambers and valves. This smooth lining is vital for facilitating the efficient flow of blood within the heart and preventing complications such as blood clots. Lastly, the pericardium is a vital protective layer surrounding the heart, often referred to as the pericardial sac. The sac typically contains between 10 to 30 milliliters of pericardial fluid. The primary function of the pericardium is to shield the myocardium, the heart's muscular layer, from potential threats such as infections and neoplastic invasions, which are abnormal growths that can lead to serious conditions. This protective role is crucial in maintaining the overall health and functionality of the heart, ensuring that it operates efficiently within a safe environment. As we progress, this knowledge will support your ability to interpret EKGs and manage cardiovascular care with greater precision. We must overview the circulatory system. The circulatory system operates as a closed-loop network integral to maintaining homeostasis by continuously circulating blood throughout the body. The system is composed of heart chambers, an extensive network of blood vessels, ensuring that all body tissues receive an adequate supply of oxygen and nutrients while waste products are efficiently removed. The circulatory system is divided into two essential circuits, the systemic circuit and the pulmonary circuit. The systemic circuit is the larger of the two circuits and involves the left side of the heart along with the associated blood vessels. This circuit is responsible for delivering oxygenated blood to the various tissues and organs throughout the body. After oxygen delivery, the deoxygenated blood is collected and transported back to the right side of the heart, completing the systemic circuit. The pulmonary circuit is the smaller circuit and involves the right side of the heart and the blood vessels leading to and from the lungs. This circuit's primary function is to facilitate gas exchange within the lungs, where deoxygenated blood releases the carbon dioxide and picks up oxygen. The newly oxygenated blood is returned to the left side of the heart, where it re-enters the systemic circuit. These two circuits work in tandem, ensuring that oxygenated blood is consistently supplied to the body and deoxygenated blood is efficiently cycled back through the lungs for reoxygenation. Now let's review the interior of the heart. The interior of the heart is organized into four distinct hollow chambers, each playing a critical role in the circulation of blood. These chambers are separated by walls known as the septa, which ensure that the heart functions efficiently as two distinct pumping systems, the right heart and the left heart. The heart's upper chambers, the right atrium and the left atrium, serve as receiving areas for blood returning to the heart. The lower chambers, the right and left ventricles, are responsible for pumping blood out of the heart into the lungs and the rest of the body. The septa are crucial as they divide the heart into two systems, allowing the right heart to handle deoxygenated blood and the left heart to manage oxygenated blood. This division ensures that the heart can efficiently pump blood to both the lungs and the entire body without mixing the two types of blood. So the chamber walls vary in thickness depending on the pressure required to eject the blood. The atria, which act as the low-pressure reservoirs, have relatively thin walls since they only need to move blood into the ventricles. The right ventricle has a thicker wall than the atria as it must pump blood into the lungs, but still under relatively low pressure. The left ventricle, on the other hand, has the thickest wall of all the chambers because it needs to generate enough force to push blood through the aorta and throughout the entire body, overcoming that high systemic pressure. The heart is equipped with four crucial valves. They ensure blood flows in one direction, preventing any backward movement or regurgitation. These valves function by opening and closing in response to changing pressures within the heart's chambers during each heartbeat. There are two types of valves in the heart. The AV valves, or the atrioventricular valves, are the tricuspid valve, which is located between the right atrium and the right ventricle, controlling blood flow between these chambers. Then there's the mitral valve, which is found between the left atrium and then the left ventricle, regulating blood flow from the atrium to the ventricle. Second type of valves are called the semilunar valves. The first one being the pulmonic valve, which is positioned at the exit of the right ventricle, leading into the pulmonary artery, and it controls blood flow to the lungs. The next one, the aortic valve, is located at the exit of the left ventricle, leading into the aorta, and it manages blood flow into the systemic circulation. These valves work together to ensure that blood moves efficiently through the heart and out throughout the lungs and the rest of the body without backflow, which is essential for maintaining effective circulation and cardiovascular health. Now let's review the blood flow through the heart and lungs. To understand flow of blood through the heart, we traditionally begin by tracing its journey as it returns from the body through the systemic veins to the right side of the heart. Starting with the right atrium, this chamber receives deoxygenated blood from three major sources: the superior vena cava, the inferior vena cava, and the coronary sinus. As blood fills the right atrium, the pressure within the chamber gradually increases. Once the pressure reaches a certain point, the tricuspid valve opens, allowing blood flow into the right ventricle. In the right ventricle, as the blood continues to fill the chamber, the right atrium contracts. This is a process known as the atrial kick, which pumps the remaining 30% of blood into the right ventricle. This final push ensures the right ventricle is fully filled and ready to pump out blood towards the lungs for oxygenation. As the right ventricle fills with blood, the pressure within the chamber rises. This increased pressure causes the tricuspid valve to close, preventing any backflow of blood into the right atrium. Simultaneously, the pulmonic valve opens, allowing blood to be ejected into the pulmonary arteries, where it is carried into the lung. In the lungs, a critical exchange takes place. Blood releases carbon dioxide, a waste product of cellular metabolism, and picks up oxygen, preparing it to circulate throughout the body. The oxygenated blood then returns to the heart, entering the left atrium via pulmonary veins. As blood fills the left atrium, the pressure within that chamber increases, prompting the mitral valve to open. This allows blood flow into the left ventricle. Now, in the left ventricle, during this final phase of ventricular filling, the left atrium contracts in a process, again, like the right side, known as the atrial kick. This contraction pushes the remaining 30% of blood into the left ventricle, ensuring it is fully prepared for the next phase. As pressure builds in the left ventricle, the mitral valve closes and the aortic valve opens. This action allows oxygen-rich blood to be ejected into the aorta, the body's main artery, where it is distributed to all tissues and organs. Now let's talk about the coronary blood supply. The heart receives its blood supply through two main arteries, the right coronary artery and the left coronary artery, each of which branches out to cover different areas of the heart. The right coronary artery primarily supplies the right atrium and right ventricle. Additionally, it's about 90% of the population that RCA extends its supply to the inferior and posterior walls of the left ventricle, the posterior intraventricular septum, as well as the AV node and the bundle of His, which is crucial and critical components of the heart's electrical conduction system. In approximately 55% of the population, the RCA also supplies the SA node, the natural pacemaker of the heart. Due to its extensive coverage, the RCA is considered the dominant coronary vessel in about 90% of our population. The left coronary artery, LCA, splits into two major branches: the left anterior descending LAD artery and the circumflex artery. The LAD is responsible for supplying blood to the anterior and anterolateral walls of the left ventricle, the anterior intraventricular septum, and both right and left bundle branches, which are essential for coordinating the heart's contractions. The left coronary artery, LCA, splits into two major branches. The circumflex artery supplies the left atrium and both anterolateral and posterolateral walls of the left ventricle. In about 10% of the population, the circumflex artery also takes on the role of supplying the inferior and posterior walls of the left ventricle, the posterior intraventricular septum, and the AV node and bundle of His, functions typically managed by the RCA. Additionally, in 45% of the population, the circumflex artery supplies the SA node. Understanding the distribution of blood flow through these coronary arteries is crucial, especially when considering the impact of coronary artery disease and the specific areas of the heart that may be affected by blockages or reduced blood flow. At Novamind LLC, our core values are firmly aligned with the American Medical Association policies, which assert that there is no biological evidence of race and it is a made-up social construct. We adhere to the AMA policies that advocate for the elimination of race as a proxy for ancestry, genetics, biology, and medical education, research, and clinical practice. We recognize that racial essentialism persists in medicine largely due to educational frameworks that perpetuate systemic and structural racism. This educational foundation contributes to unconscious bias in medical research and healthcare delivery, causing significant harm to women, marginalized communities, and society as a whole. Novamind LLC sets itself apart as the pioneer in healthcare equity, education, and professional development through our unwavering commitment to these principles. Every course we create is designed to identify and challenge the ingrained biases that have historically influenced and continue to affect healthcare today. Our approach goes beyond simply delivering content. It's about transforming, understanding, and redefining standards and setting new guidelines for educating healthcare professionals. And that wraps up our deep dive into the heart's anatomy and physiology. We've explored structures and functions that keep your heart beating strong, laying the foundations for understanding how it all works together. As we move forward in this series, remember that mastering the basics of the heart structure is key to advancing your skills in EKG interpretation and ACLS. In our next episode, Electrophysiology Unveiled, How Electricity Powers the Heart, we'll uncover the electrical system that drives the heart rhythm and ensures every beat is perfectly timed. This knowledge will be crucial and continue to build your expertise from basic EKG to life-saving ACLS. Stay tuned and get ready to master the beat. Also, please feel free to pause to read the following AMA references for the policies I stated in this beginning of this lecture, and also the references to all of the scientific articles that I've referenced in this lecture. Thanks, and hope to see you at the next one.